difficult. I know this baby moves around a lot. Okay, good. Can you hear that?
Yeah.
Strong little heartbeat. Excellent. We have a multidisciplinary team approach. We discuss all of our pregnant women with their permission, so they all know that we are discussing them on a professional basis. We talk about their medical needs, their emotional and their social needs. So we have psychologists, pharmacists, as well as the midwives and doctors. And Positively UK are actually an integral part of that, so they will often feed in, always with the patient's, the woman's permission, into our multi-professional discussion.
The From Pregnancy to Baby and Beyond project is really about, firstly, supporting women with HIV who want to have children. A lot of women don't understand that they can have children naturally and that HIV is not a barrier to having a family life.
So part of my role as project manager for the From Pregnancy to Baby and Beyond project is to bring together all different people. So we're talking about bringing together healthcare clinicians, specialist midwives, the women living with HIV, and the mentor mothers who are trained to provide the support to them.
And one of our biggest roles, I think, in informing women is actually they don't need to have a caesarean section now, providing that their viral load is undetectable and they're on antiretroviral therapy. Then we encourage women to have a normal delivery. We're all set for the delivery.
Yeah.
So as we said, we might do a caesarean section as last time, but we'll see. If you go into labour yourself, then we'll try and have a normal delivery this time.
Okay.
And our aim is to really normalise pregnancy as much as possible for women who are living with HIV.
About a third of the people living with HIV in the UK now are women, and in our clinic 65% of the people that access our service are women. And women have very particular needs. Of course there are reproductive decisions to be made and motherhood comes into it, but actually there's a lot of other things that impact on women's lives, their position in society, how their lives work, which requires very specific support.
I myself had a baby after my diagnosis, and I think it's extremely important to get the information, the peer support, the emotional and the practical support that you need upon diagnosis.
We are able to offer a particular form of peer support, and Positively UK have a mentor mother programme which we are part of. We're very delighted to have women who can help support our patients through motherhood.
The project lead and all the volunteers on that project are also women living with HIV, all who have had children post their HIV diagnosis. And that's really crucial if we're to look at long-term sustainability of the project, that it's about educating and supporting the community of people living with HIV to provide that support within themselves.
They are training HIV positive mothers to actually be a support network for other mothers who are coming up, helping them to understand, be there as I'd say as the midwife would, with women, okay, and show them, look at me.
At the moment, I feel good. I feel blessed. I take my medication every day.
So a woman will come into the clinic, let's assume that she's been newly diagnosed with HIV, she'll have that news, and we offer her immediately somebody to talk to. Now, quite often we find that at the very beginning people are very reluctant and say, no, I'd rather not. So we make the offer regularly.
Within the clinic I'm based, I see people for a variety of needs relating to social care, so it can be financial support, access to housing, immigration support, to try and reduce people's isolation, for example. Social care is a very broad remit, and I think there's a couple of problems around sort of financial problems and that sort of thing, which I think she'd really value meeting someone.
Does she have any other children? It's just so I know which, to pair her up with.
No, this is her first
pregnancy.
Positively UK come in every week to provide one-to-one peer support. And it is about breaking down that fear of disclosure, that isolation certainly that a HIV positive diagnosis can create for people.
I thought, and here is this fundamental thing that had changed my life, and I wanted somebody to talk to.
One of the key things we make sure we say to them is they should be able to disclose from a position of power, and by that I mean they need to feel safe and they need to feel supported, so that they need to be able to cope with whatever reaction they will get. But it's about being prepared.
I was assigned a caseworker, and she was another positive woman, and we spoke a lot. She gave me a lot of advice around disclosure, and also like the preparation of what people's different responses may be. And ultimately we have no control over that.
But for many women it's extremely difficult to disclose, and for me I felt it was important that my daughter knew my status. I didn't want her to find out about me from anywhere else.
You want them to see that life goes on. This is not a death sentence anymore, which is mostly what goes on in their mind. I will live to see my children go to university. I will live to see my children get married.
It's amazing that the difference that makes for women to be able to go along and talk to other women who have been through services, know what the situation is like, and also come out the other side.
Through the Mentor Mothers and Positively UK, women and their partners do feel more able to share in a safe space, to share what their real issues and worries are, that they don't always feel able to go directly to the health professional with.
Actually, you have to straight away, if you're bleeding,
Exactly.
you call straight away, you have to call the ward, or you have to come straight away to the hospital.
Good. So we're a good team. We just need to see
Yes,
this baby,
yes.
don't we? This particular couple felt that there were issues that they didn't feel able to speak to their doctor and the midwife about. They approached Angelina at Positively UK directly. With their permission, Angelina then contacted me about their issues, and I then arranged to see the couple again and talk to them. So
The fact that it is the clinicians that introduce the peer support actually gives a level of trust and understanding, and seeing it as part of the holistic team makes an enormous difference.
At the moment, our peer workers and volunteers are integrated across 10 healthcare clinics across London.
But of course, peer support requires people who are living with HIV to be open about their status to somebody else and to encourage other people, and that's actually quite difficult. And in this clinic, we see a lot of people who are not necessarily born in the UK, many of whom are women, and for them, the issues of disclosure and talking to other people are quite difficult.
This is the first time that they're having a baby knowing of their diagnosis, so you still have to deal with that issue.
They undergo a 3-day training looking at their role as a volunteer, how to work within Positively UK's policies, how to set SMART goals with their mentees.
I would encourage any woman to access support. There was nothing more powerful for me than meeting another positive woman.
I decided I wanted to do something, maybe to better myself or to learn more about HIV. Then I asked the woman who was supporting me, and I said, is there any opportunity for me to volunteer?
The volunteers for the Pregnancy, Baby and Beyond project, working with Angelina, have to have either had children post-diagnosis or be considering getting pregnant or be pregnant at the time. And actually, if they've had a child more recently in the last few years, that's even more useful because treatment and the Beaver guidelines have changed so much in the last few years.
I've learned a lot from it, things which I didn't even know, or it's made me a different person. The way I think is different, completely different from the way I was, and I enjoy it so much.
I come in as the midwife. We've got various roles, and I will help them through the postnatal period to know what we actually do after the baby is born. What would they need to know?
So we've had people from the Royal Free and from other hospitals go to speak to them about preconception care, about other issues. So Debbie Levitt, who's our psychologist, she's been great in helping with the psychological aspects and disclosure issues and so on. I've talked about birth plans, and Anna, our specialist midwife, has also talked about mode of delivery.
The bottom line is that I say to them, we can do something to help baby. There is nothing in life that is 100% guarantee. But from what I have seen and the history that we've had, we're getting there. By quoting today, our last positive baby was in 1999. Okay, and that's brilliant. That's a massive record. We have over 470 babies that are negative, and we are very proud of that.
Of course, people still need to have access, and access is a very complicated term, and for some people coming to hospitals or engaging with medical care is difficult, even if at the end of the day the treatment is good and it's free. And so there are a whole variety of ways of trying to make treatment more accessible.
I do believe we're the only place in the country that actually has dedicated social care 5 days a week, based in clinic. I'm not a social worker, but I'm here to try and sort of identify the social care needs and then refer out to try and get those needs addressed, or at least, like I say, to give people information to make informed choices.
Medical care and social care have up to now been separated and disjointed, and it's really important to bring them together. And we have another opportunity now, because as the Health and Social Care Act has gone through and so much more is resting with local government, we need to make the case and to argue that it is the wider determinants of health that are really important, and make sure that the people now who are commissioning healthcare understand they need to be commissioning social care and integrated packages of care at the same time, if this is to be rolled out and to be available to everybody.
But I think in the times of financial austerity, it's difficult for funders and everything to work out what is important, what's key, what's a luxury and what's a necessity. And realistically, I don't think anyone can say that peer support isn't anything but an absolute necessity. So it's something that needs to be incorporated in every clinic, in every model, to be used across the country.